I had grown up on a farm, a cattle ranch in southeastern Idaho, out on the desert, 5 miles from our closest neighbor. I jokingly say that I was basically alone, just me and my parents. I'm not willing to count my brothers as human beings. They're just part of the animal crowd. When I first came to the University of Utah, it was in a straight-through PhD physics program. I was sitting in the physics lab one day, though, talking to one of our postdocs. He said, "You believe that you're going to graduate in physics and then go into some sort of research and teaching program." He says, "The thing you don't understand is that the line for teaching programs in universities is," he says, "several hundred people long." I decided I'd just apply to one medical school one time here at the University of Utah.
I first became aware of Brent James in 1973 because he was in a cohort of students that had been early admitted to the University of Utah Medical School based on the high potential that was seen by others.
I told them that I was trained to do research, that I didn't care if I ever saw a patient in my life. And, they accepted me anyway.
Initially, he became known as being very, very bright.
It was massive serendipity, good luck to my benefit, to have happened to fallen into a program that had the leading computer science lights of the world, but also for medical informatics, the leading program in the world. I didn't plan it.
I remember very well when Brent came to Intermountain, and I was in full-time clinical practice, and he came bearing data.
He has a master's degree that allows him to rigorously analyze this scientific data and put it into practice.
Brent has helped us as physicians and people engaged in healthcare really understand our culture better and understand important ways that we need to improve.
As you improve quality, in this case clinical outcomes for patients, fewer deaths, more function restored, it reduces the cost of healthcare.
Over the years, Brent has trained thousands of our Intermountain colleagues in the techniques of quality improvement through his advanced training program.
Higher quality costs less if you approach it from the right direction. Way back in the early 1990s, we started to apply that broadly.
He inspired everybody, no matter where they fit on the performance spectrum, to be better.
It became part of a national movement. The American College of Surgeons nationally runs something called the National Surgery Quality Improvement Project, and it all traces its roots back here to Utah.
Well, Brent James has become probably the most well-recognized expert on clinical quality in the United States, probably the world.
We're in partnership with the government of Sweden. We're in partnership with the government of France. I run a training program that teaches the methods. We have more than 50 sister training programs.
And it's really fun as I go to other parts of the country and even other countries. As I mentioned that I'm from Intermountain Healthcare, how frequently people say, "Do you know Dr. Brent James?" And they're always excited when I say that I do. Whenever people talk about him, they talk about his infectious energy for doing the right thing.
Brent has not only become world known for that, but he's brought Intermountain Healthcare really to the forefront of evidence-based medicine.
We count our successes in lives, literally. I can document more than 1,000 lives per year of people who a few years ago would have died.
At the bottom of all this, it wasn't about cost, it wasn't about Brent's position of power, it wasn't about anything except doing a better job for the patients that we serve.
The key thing is care for other human beings, to ease some of life's burdens, to take away the hurt, to make life longer and fuller. And frankly, we've had a tremendously good run. It's easy to make the case that clinical care today, medicine today, is the best the world has ever seen.
So many people, after they become successful and well recognized for their work, it changes them in ways that aren't always great. It becomes more about their ego or about their career. But that's not the case at all for Brent.
He has done things that no one has done before, and yet been able to keep his feet closely on the ground.
There are a few people who are in the perfect job for their passion, and Brent's one of those people.
There are days when I'm just amazed that they'll pay me to do this. I mean, seriously, let me go play in this sandbox, then pay me. What a joy.
If he'd been a surgeon, he would have made a profound difference for thousands, but as a physician to a whole health system, helping us improve our processes. He's had an impact that goes far beyond that. Undoubtedly millions of patients throughout the world.
And that all sprang from wonderful years as a student at the University of Utah, an institution whose influence has changed the world. Thank you. Thank you very much to the University of Utah Alumni Association for this signal honor. I realize that it's not just me, it's really a large group of people, thoughtful, dedicated people who made it happen, and it's my privilege to stand in their place to represent this body of work and this truly impressive achievement. On my behalf and on their behalf, I thank you for your honor and consideration. I'm proud to be a Ute, and I hope that you feel that I've represented our name well in the university, in our state, and in the world.